Assalamualaikum and good day everyone. We are going to present about ergonomic reads during vacuuming. Vacuum are the most used cleaning equipment in all household tasks. Thus, right equipment and using proper ergonomic methods is critical. Understanding the ergonomics of cleaning and vacuuming will help to avoid injury. Most housewives will use a vacuum as a cleaning tool at least once a week. Originally, a vacuum is not a dangerous tool, but the frequent use with improper ergonomics will cause harm toward the body, especially in the musculoskeletal region. Thus, this study is held to investigate the common faulty posture during vacuum so it can be correct and identify the recommendation for that problem to eliminate the risk factor of having musculoskeletal problem.
Firstly, for the introduction, vacuuming is a type of household cleaning that commonly causes muscle fatigue and discomfort on upper limb as it is being performed frequently in every household. Studies reported that an ergonomic, organizational, and personal measures that designed to reduce repetitive movement, awkward posture, and having a resting break with exercises is important to reduce the development of musculoskeletal disorders that is caused by vacuuming. Therefore, the objective of this study are, firstly, to investigate the common faulty posture during vacuuming, secondly, to determine the most accurate posture during vacuuming, and lastly, to provide recommendations in eliminating risk factors of musculoskeletal disorders during vacuuming.
Now we move on to the literature review. According to Don and Carr 2017, household management that requires routine and household maintenance tasks such as cleaning, cooking, and others is a common work-related event that could lead to musculoskeletal disorder. Floor vacuuming, which commonly used during cleaning, has reported a high incidence of musculoskeletal disorder occurrence among housewives and cleaning workers in previous studies, due to the nature of activities that involve repetitive movement and frequent bending position. As a result, there are few factors that need to be considered or modified to reduce the risk of this problem. In a study by Lee et al. 2016, they emphasized on the appropriate length of the vacuum handle for proper handling as it can affect motion and muscular effort specifically at the shoulder, forearm and wrist. Meanwhile, in a study by Jett et al. 2016, they mentioned that one should maintain their body's neutral position during vacuuming to prevent the risk of having these fibers strain. Therefore, the use of right equipment and correct ergonomics are important to reduce the risk of this health problem.
Next is methodology. We use Cornell Musculoskeletal Questionnaire to evaluate musculoskeletal assessment. We also use Dodge Initial Era Checklist to evaluate ergonomic risk factor, and we using some instruments such as goniometer to measure the range of motion, measuring tape, and application on the smartphone, which is decibel to calculate the frequency of sound, and camera phone to take the picture.
Next, for the result, we use Cornell Musculoskeletal Questionnaire. Based on the analysis of musculoskeletal assessment, we found that one respondent reported experiencing pain and discomfort at the feet, followed by two respondents complaining of pain at lower leg, hip, and buttocks, and also upper arm. Next, 3 respondents experienced pain at the knees and forearm, followed by 4 respondents stating that they have pain on the upper back. The lower back was the highest reported discomfort by 7 respondents. The second highest reported body part to feel pain and discomfort is at the shoulder and neck area.
Alright, next we are going to talk about discussion. Work-related biomechanical risk factors of low back pain are because of frequent or prolonged bending is consistently, and it is very harmful. Neck pain is a result of bad posture when cleaning or doing repetitive movement for a long period of time. Exposure to constant and excessive noise causes hearing impairment and health problems, including headache, elevated blood pressure, and fatigue.
And lastly, in conclusion, an ergonomic working environment should be practiced in order to reduce development of musculoskeletal disorder. The study reported that housewives and maids complain of pain, especially on the neck, the shoulder, and lower back. The pain is caused by prolonged and static posture, repetitive working movement, overloading of work, and environmental factors such as noisy environment that cause disturbance and annoyance. Therefore, some ergonomic recommendations has been stated to overcome the problems that has been mentioned. Firstly is appropriate posture. This is aimed to reduce the tension of muscle. Practice step standing position while vacuuming the floor, and also practice kneeling and forward bending while vacuuming a narrow space such as underneath sofas. And also, it is recommended to use an extension nozzle to reach out on the further part area. Next, before starting the vacuuming activity, make sure to tidy up the area first. This is to avoid an awkward posture such as vacuuming while lifting up chairs. Plus, any hazard can be detected prior to vacuuming. The next recommendation is rest in between. Practice intermittent vacuuming to allow relaxations of muscles, which means to avoid muscle fatigue. Lastly, open windows or doors. This is to allow ventilation in the area that will be vacuumed, and also to allow dust flow out through the windows or doors.